My name is Peter Nate Agboyemo. You are live on Zimbo TV Gh News in our studio here at Dabala Junction. And to our top stories. The Assembly member for Jebetato electoral area, Mr. Peter Newton Doe, has appealed for support to complete a chief compound project following roofing done by Agave Rural Bank. In other news, Professor Peter Kotik asked government to restore road tolls. More to come, Marburg virus forces Ras Mubarak to reroute Trans-African Road Tree. Let's settle for the details now. The Agave Rural Bank ARB PLC has provided significant support to Jebetato self-initiated community-based health planning and services Chiefs project by covering the roofing cost estimated at an amount of 36,800 Ghana cedis in response to an appeal by the Assembly member Honorable Peter Newton Doe. The Chiefs Compound project, launched in 2019, has faced challenges due to resource constraints despite being financed through community events, diaspora's contribution, and NGOs. The facility is designed to house units of maternity and reproductive health services, a dispensary, consulting rooms, detention area, and storage rooms. According to the Jebetato Planning Committee, the project aims to bring healthcare services closer to the community, improving accessibility for children, lactating mothers, and pregnant women. The committee emphasized the importance of community-driven initiatives taking their destiny into their own hands to enhance healthcare delivery. Assembly member for the electoral area has expressed gratitude to Agave Rural Bank, highlighting their corporate social responsibility efforts to improve community lives. He appealed to the government, NGOs, and philanthropists for further support, stating, "On behalf of the entire community, we are asking for support both in cash and kind to complete these community-based health planning and services compound projects at Jebetato." The completed Chiefs compound is expected to provide critical healthcare services, including maternal and child health, disease prevention, emergency care, and general healthcare services, health education, and outreach programs to the local communities. Away from that, recruitment into the Ghana Armed Forces in the Greater Accra region is set to resume today, Thursday, November 2025, following a temporary suspension of the exercise at the El Wak Sports Stadium after a stampede claimed 6 lives on Wednesday, November 12. Following the tragic stampede, President John Dramani Mahama ordered the GAF to halt the process to reevaluate safety procedures because and restructure screening system to prevent a reoccurrence. In an interview announcing the resumption, the Ghana Armed Forces said the strengthening measures has now been implemented to ensure a safe and orderly exercise. Key among these is a creation of 5 separate screening centers to manage the flow of applicants and reduce crowd pressure. The Director General of Public Affairs at the Ghana Armed Forces, Captain Veronica Ajo Ahin, said the new arrangement will strictly limit the number of applicants admitted each day. According to her, only 1,200 applicants will be screened daily. She added that the screening process will run for a minimum of 5 days and will be conducted in phases, beginning with verification of applicant information and physical examinations. Away from that, let's now take you to the transport system, where the immediate part director for the Institute of Statistical, Social and Economic Research, ISA, Professor Peter Korte, says Ghana must expedite efforts to reinstate road tolls and strengthen its public-private partnership (PPP) framework in its hopes to mobilize the level of financing needed for the 198.7 kilometers Accra to Kumasi Express, a flagship project under President John Dramani Mahama's Big Push infrastructure program. He argues that sustainable finance, not political ambition, will determine whether the expressway become a transformative economic corridor or another stalled national project. His comment followed the Finance Ministry's reaffirmation that the government remains fully committed to completing the expressway within 3 years to ease mobility, reduce logistics costs, and stimulate trade between the country's two largest urban economies. According to him, Ghana weakened its infrastructure financing credibility when it scrapped tolls, a key cost recovery mechanism that international investors recognize as standard practice for major highway. Professor Korte maintained that tolls must run quickly back and improve road quality and efficient electronic system to restore investor confidence. Citing Kenya's Modern Tool Expressway, he argued that well-structured PPPs can accelerate project delivery, improve maintenance, and reduce long-term fiscal pressure. Professor Korte stressed that without creditable finances reform, Ghana risks delaying a project that has potential to unlock development, boost regional competitiveness, and reshape the country's transport economy. Let's complete our bulletin where the Trans-African Tourism and Unity campaign has suspended its planned road trip to Addis Ababa, Ethiopia, following the confirmation of the country's first ever outbreak of Marburg virus disease. In a statement issued in Kampala, Uganda, and signed by Ras Mubarak, the lead campaigner and former member of parliament for Kumbungu, on Wednesday, November 19, 2025, the group said the decision was taken in the interest of public health and safety after Ethiopia's Ministry of Health confirmed the outbreak on November 14. The disease, a highly fatal hemorrhagic fever similar to Ebola, has so far been detected in Janka town in South Ethiopia region, with 9 cases and 3 deaths recorded. The campaign, which is advocating for a free visa African, has been scheduled to arrive in Addis Ababa on Friday, November 21. However, Ras Mubarak announced that the team has now aborted that leg of the journey and revised its travel itinerary. This change of the plan is due to the health risks associated with the ongoing outbreak. The inconveniences caused by countries originally scheduled to be visited is deeply regretted, a statement added. Under the new route, the team will move through Rwanda, Tanzania, Zambia, Namibia, the Republic of Congo, Gabon, and Cameroon countries they had already passed through, before heading to Burkina Faso, Ivory Coast, Liberia, Sierra Leone, Guinea, Guinea-Bissau, Senegal, Mauritania, and Morocco. They will then return to Ghana via Mauritania, Senegal, Guinea, and Ivory Coast routes. The group appealed for cooperation from authorities in all countries along revised route as they continue their advocacy for free movement across the continent. Here brings us to the end of our bulletin here in our studio at Abala Junction. I am Peter Nate Agbayoma.